So here are some causes of loss of consciousness that are divided into different systematic categorization. CVS, in CVS the MI may be the cause of the loss of consciousness. To rule out the MI, you can do the ECG, and arrhythmias might be the cause, and the hypotension might be cause of the loss of consciousness. Then the CNS, in CNS the stroke, epidural hematoma, and the subdural hematoma, that is through the road traffic accident or the traumatic cause, that can also result in loss of consciousness. And then the infection of the brain, meningitis. There is a triad of the meningitis, includes the high grade fever 103 to 104, and then headache, severe headache, fever, and neck rigidity is the triad of meningitis, and meningitis can also result in loss of consciousness. Then the hypertension and diabetes mellitus can also result in loss of consciousness, because hypertension result in stroke, and stroke also cause loss of consciousness, and diabetes results in atherosclerosis, thinning of the thickness of the vessels because of the diabetes, and that will decrease the blood flow. So ischemic stroke can be caused by diabetes. Then the blood thinner like the aspirin, also known as loperamide, result in stroke and loss of consciousness, and fits are also the reason for loss of consciousness. Then the metabolic causes include the hypoglycemia, decreased sugar level, you can rule out by the uh, sugar levels, and then hyperglycemia, increased sugar level, can also result in loss of consciousness or the drowsiness, like in the diabetic ketoacidosis. You have to see for the diabetes the levels of the sugar and then ketone bodies through the urine or the blood sample. And then acidosis, pH, uh, hyponatremia, decreased sodium level, and hyponatremia, increased sodium level, can also result in loss of consciousness. The normal sodium levels are 135 to 145, and normal potassium levels 3.5 to 5. Then miscellaneous causes include the drug abuse. The drug abuse of opioids and organophosphate poisoning can also result in loss of consciousness, and alcohol withdrawal. In case of the opioids and organophosphate poisoning, there will be the pinpoint pupil that will indicate these reasons behind the loss of consciousness. And then after the CNS, CVS, metabolic, and miscellaneous causes, sepsis is one of the causes. In this case, sepsis mostly in the elderly or old patients, and sepsis caused due to urinary tract infection or respiratory tract infection. To rule out the urinary tract infection, you can take the history of urgency, frequency, and all other symptoms of the UTI, and also you can do urine RE. And for respiratory tract infection like the pneumonia, you can do chest x-ray. And the last cause for the loss of consciousness or the drowsiness is the stress or the anxiety.